She was a fun, bubbly girl, very well liked. She had a lot to look forward to in her life.
David Moore from Shildon lost his daughter a year ago. 18-year-old Emily died a week after being moved to an adult mental health ward at Lanchester Road Hospital in County Durham. Her family say she took her own life.
Until you've experienced not a relative but a child, it's unspeakable. You get that many emotions, and you, in a way, you don't want to be here either.
Emily was under the care of Tees-Esk and Wear Valley's NHS Foundation Trust. Before moving to Lanchester Road, she had been in a children's mental health ward at West Lane Hospital in Middlesbrough. Her family claims staff across the trust showed little care or compassion, and Emily wasn't supervised when she was supposed to be.
If she'd had better care, rather than just being left to her own devices, she could have been here today.
Because Emily had been a patient at West Lane, her death is subject to an independent investigation. The inquiry is focused on the failings of the hospital, which was shut by inspectors in 2019, following the deaths of patients Nadia Sharif and Christy Harnett. They were both 17 and died within weeks of each other. The hospital was ruled inadequate, and the Care Quality Commission said patients were at high risk of avoidable harm. That independent investigation into West Lane, which was commissioned by NHS England, is expected to conclude in the summer. But I've been told that it doesn't go far enough, and a broader inquiry is needed. An inquiry that would investigate other deaths under the Trust's care, in other hospitals and in the community. Deborah Coles is the director of a charity supporting bereaved families. She's aware of at least 14 deaths in the last 4 years.
I mean, these are alarming figures. You know, one death is one death too many, but to see a pattern of death, and many of which raise similar concerns about failings, it really is a matter for extreme public concern and warrants a proper inquiry into the trust itself.
One of those to lose their life was 23-year-old Victor Scott Brown from Anfield Plain.
Basically, Victor was failed by the Trust on multiple levels.
In 2018, 3 weeks after being prescribed a new medication for his suspected bipolar disorder, Victor took his own life at home. A coroner ruled his death was avoidable.
Coroner's inquest found that it was the prescription of the particular drugs that he'd been given that pushed the suicidal intent and actually made him take his own life. The coroner also found that Victor should have had a warning about the drugs that he was going to take, and should have been issued with a warning leaflet from the Trust to say, if you have suicidal thoughts, then you must stop taking the drugs immediately.
For us now to have to accept that Victor still could be here had he been given the care that he should have been given is extremely difficult for us to have to live with.
For the families of Victor and Emily, they know nothing can bring their children back. But for the sake of others, they say there must be a public inquiry.
We don't feel that they're fit for purpose. Scared that, young people who are currently under their care are not being given the correct treatment, the correct care that they're entitled to.
How many more? How many more? You can't have people dying. There needs to be a big investigation, and hopefully answers will come from that.
Well, we've got some work to do. Inevitably, there have been some really difficult things that have happened, some really troubling things, some really sad things. And definitely our hearts go out to people, and each and every one of those cases has been looked into. There are some clear changes that we've already made. We're making changes to care plans and risk assessments, to some of our ward routines, and we've been making investment in our environments to make them safer for people. I've met with both David Moore, Emily's father, and Victor's parents, and I've got an open conversation with them at the moment, and we're trying to work through their feedback and their issues. I don't believe, as I've said, that any broader more systematic investigations indicated or justified.